The next document we will discuss is informed consent extraction. Informed consent is a modern and ethical process for getting permission before conducting a healthcare intervention on a person. A healthcare provider may ask a patient to consent to receive therapy before providing it. Aligned with the above, please read the following information for informed consent purposes. Potential problems with loss of teeth. When a tooth is extracted, it often requires replacement with a denture, bridge, or implant. If it is not replaced, the space can cause other teeth to shift and become crooked, affecting your bite and the ability to chew properly. This does not apply to all teeth or in all cases, for example, wisdom teeth. The loss of an important or significant single tooth can have a major impact upon your dental health and appearance. Problems can occur gradually over time. For example, 1. The opposing tooth may over-erupt. 2. The unprotected dental ridge is subjected to trauma. 3. The neighboring teeth tilt and proper bite is lost, leading to tooth sensitivity, wear, broken teeth, jaw muscle and joint problems. 4. The drifting teeth create food impaction areas where decay or gum disease starts. 6. Destruction of the bone will result as teeth drift and tip. Options. If a tooth can be restored and the bone around that tooth is sound, then it is generally advisable to save the tooth. Overall, the benefits of natural teeth outnumber the benefits of prosthetic or replacement teeth. However, if the prognosis, expectation, or prediction of a tooth is guarded, poor, or is non-functional tooth, for example, a wisdom tooth that has significant caries or becomes repeatedly infected, it may be recommended to have such a tooth removed. Extraction of a tooth, whether routine or difficult, is a surgical procedure. As such, in any surgery, there are some risks. Even a simple routine scale and polish have risks. They include, but are not limited to: 1. Swelling or bruising and discomfort in the surgery area. 2. Stretching of the corners of the mouth resulting in minor injury and bruising. 3. Possible infection requiring further treatment. 4. Dry socket, jaw pain beginning a few days after surgery, usually requires additional care, and it is more common in the lower extraction, especially wisdom teeth. 5. Possible damage to the adjacent teeth, especially those with large fillings or crowns. 6. Numbness or altered sensation in the teeth, lip, tongue, and chin due to closeness of the tooth roots, especially wisdom teeth, to the nerves, which can be bruised or injured. This can potentially occur even during root canal treatment or dental implant placement. Sensation most often returns to normal, but in very rare cases the loss may be permanent. 7. Trismus. Limited jaw opening due to inflammation or swelling, most common after wisdom tooth removal. Sometimes it is the result of jaw joint discomfort called temporomandibular joint, TMJ, especially when TMJ disease and symptoms already pre-exist. 8. Bleeding. Significant bleeding is not common, but persistent oozing can be expected for several hours. 9. Sharp ridges or bone splinters may form later at the edge of the extraction socket. These may require another surgery to smooth or remove them. 10. Incomplete removal of the tooth fragments. To avoid injury to the vital structures such as nerves or sinuses, sometimes small root tips may be left in place. 11. Sinus involvement. The roots of the upper back teeth are often close to the sinus, and sometimes a piece of root can be displaced into the sinus, or an opening may occur into the mouth, which may require additional care. 12. Jaw fracture. While extremely rare, it is possible in difficult or deeply impacted teeth. Most procedures are routine and serious complications are not expected. Those which do occur are most often minor and can be treated. To ensure rapid healing and to avoid complications that could be both harmful and painful to you, please follow these post-operative instructions carefully. A. Bleeding. Bite firmly on gauze pack that has been placed in your mouth until you arrive home or for at least 1 hour, and then remove it gently. If after removal bleeding begins again, place another damp gauze pack directly over the tooth socket and bite firmly for 30 minutes. Biting on a tea bag that has been moistened and wrapped in a piece of gauze also helps to stop the bleeding. It is not unusual to have a slight oozing for up to 24 hours. You may find a blood stain on your pillow in the morning. Keep your head elevated with several pillows or sit in a lounge chair. Do not spit or suck through a straw, since this promotes bleeding. Do not smoke or drink alcoholic drinks for 12 hours because this will promote bleeding and interfere with healing. B. Medications. Some discomfort is normal after surgery. It can be controlled but not eliminated by taking the pain tablets prescribed by your dentist. Fill the prescription very soon and start taking as directed. Take your pain pills with a whole glass of water and with a small amount of food if the pills cause nausea. Note, do not drive or drink alcohol if you are taking prescription pain pills, and please note that some antibiotics may temporarily nullify the effects of the oral contraceptive pill. C. Diet. It is important to get adequate nutrition to help the healing process. Eat normal, regular meals as soon as possible after surgery. Cold, soft food such as ice cream or yogurt may be the most comfortable for the first day. D. Oral hygiene. Do not rinse your mouth or brush your teeth for the first 24 hours after surgery. After that, rinse your mouth with warm salt water, half a teaspoon of salt in a glass of warm water every 4 hours. Brush your teeth but avoid the area of surgery. E. Swelling. To help prevent swelling, ice packs should be applied to the face adjacent to the surgery site. Apply the ice pack for 20 minutes on and for 5 minutes off until bedtime on the day of the surgery. Ice is not particularly beneficial after the first day. Swelling peaks at about 48 hours after surgery and then starts to go down significantly. Significant swelling beyond this point could mean infection. The surgery site may need to be examined to ensure that healing is progressing normally. If stitches have been placed in the area of your surgery, you may need to have them removed in about a week. An appointment will be made for you if this is required. I understand that bisphosphonate medication can increase the risk of bone necrosis by 5%. This is very important to put in the document. I understand that it is vital for me to continue to see my dentist. Natural teeth and appliances have to be maintained daily in a clean and hygienic manner. Yearly examinations are important in case of any adjustments that are required. This yearly examination may include visual examinations, gum probing, assessment, and adjustments of the bite. Normal fees will apply for these procedures. I acknowledge that I have provided an accurate medical history, will follow treatment recommendations, and have had the opportunity to ask questions about these risks. I understand that the fee for my extraction does not include the fee for the restorative work. I certify that I have read and fully understand this document. I hereby give consent to perform the necessary treatment. And finally, the patient's name has to be filled in the document. They need to sign the document. This document needs to be witnessed, and the date and time ideally placed on this document. And finally, this needs to be scanned and added to the patient's file. It is also a good idea that the dentist countersigns this document with the following phrase: I hereby certify that I have explained the nature, purpose, benefits, risks, and alternatives to the proposed treatment. I believe that the patient fully understands my answers and explanations. And the same thing, sign, date it, and put it on the patient's file. And most important, handwrite and get the patient to sign the location of the dental extraction.